Hi, I'm Shannon Brinker with the Academy of Chairside Assisting. I'm very excited today to walk you through a whitening procedure with the Venus White Ultra. I will say that it's exciting also for me because Haley is my daughter, and we utilized the first series of whitening that Kulzer had came out with back in 2016. We whitened Haley's teeth with the Venus White Ultra right when it was first launched. So if you think about it, this is 2021. She had an amazing experience, and when we really wanted to showcase the new changes within this new whitening that Kulzer has just launched, I thought, what better patient than Haley to look back at where she was and really to go through a little bit about what happened the first series of whitening that they released, and then now what is the difference in this new system that they have. I'll say that one of the things that was really important to me is, of course, she's my daughter, but most importantly, making sure that she did not have post-operative sensitivity, and most importantly, had a really good result, which we did, or we wouldn't waited so long. Now it's 2021 to whiten her teeth again. But Haley has very, very sensitive teeth. And so this has really been the only whitening material even on the market that she could utilize to whiten her teeth that did not cause her that discomfort. So I'm really excited today about this new whitening with the Venus White Ultra. It's a 15% hydrogen, so you still got the strength of a hydrogen, but they've added now potassium nitrate. Again, when we look back when she was, a lot younger and we whitened her teeth, she didn't have sensitivity, so I feel really confident now by going from the 11.2, which is what we used back then because she was younger, to this 15% and knowing that she's not going to have any discomfort, again, because they've added the potassium nitrate. What I want to walk through today is just really taking you back a little bit and going through the procedure steps, making sure that you are really going to gather all the necessary records to make sure that you are documenting where the patient is going to start the day that you deliver the trays, and then most importantly, understanding what is their role with the whitening when they go home. And so that's what I want to really pay more attention to today. And of course, we know we've got a great result, so I'm really excited to really now brighten those teeth back up again for her and see how long this whitening is going to last, which again, I'm very, very happy about doing this today. So before we begin, the very first thing that I always do is I want to take some photos of Haley, because once her teeth start getting lighter, if we have not taken our photos with the shade tab and making sure that we document this is exactly where she is today, we can't get it back. And that is one of the most important things as a dental assistant or anyone in the practice is going to be performing these procedures has to remember. I see this so much is we'll take the photos maybe at the pre-op, but then we never get the patient back. We don't know what they achieved. And that to me is the very most important piece of the story is when we don't have, the final photos. I always want to know what our patients, expectations are from the very beginning, but if I never know exactly where they were and we celebrate with that final result, we kind of again lost the story. So today what I want to do is I want to take a full face of Haley. I'm going to take a smile shot. I'm going to insert some retractors and get a shade tab, because again, I want to know exactly where we're starting, because I know we're going to get a great result because we've already done this with her before, but with this new formula, I really want to document it. So the first thing that I want to do is I want to capture those images that we talked about. I'm going to get a full face, a smile, a retractive view, and a shade tab. And again, remembering where Haley is starting today. Once she starts that whitening process, we can't get it back. So I'm going to go ahead and take my full face photo, and then I'm going to jump right to my smile shots. So Haley, what I'm going to do is I'm just going to have you smile really big for me. Beautiful. And then I'm going to just have you lick your lips for me really good. And I'm just going to slip these in. Okay. And I'm just going to slide these in. And I'm going to have you do me a favor, Haley, and hold those. And hold them way out here to the end. Okay. Perfect. I'm just going to take a quick photo of you. Great. And stay just like that for me. I'm just going to put in my shade tab. Let's just see where you are. I'm using our Vita classical guide. Now, I will say that a lot of team members will use this guide and they don't have these bleach shades on the end. This is very vital because I know Haley is going to get amazing results because she has done this before and really got great results. So I definitely know it's going to happen again. And what happens is I see a lot of practices don't have anything wider than B1. Well, what happens if I get wider than B1? it kind of is a downer, right? It's not that celebration that we were looking for. So I want to always make sure that I have that. And Haley's teeth are fairly light. I will say that she's probably close to a B1. And Haley, hold your head up just a little bit for me and separate your teeth just a hair. And she is right on a B1. Turn just a little bit for the camera there. Let's see if we can just kind of show. This is exactly how I'm going to take my photo. I always want to have that shade tab right underneath the central. And I also want to make sure that I capture the shade. I've had team members before take photos and all we get is the little shade tab, but we don't see the number. And how am I supposed to remember that with the camera? So stay just like that, Haley, for me. And I'm going to just take a quick picture with that shade tab, okay? You say just like that. Shaking too much coffee. Oh, that's perfect. So before we start, what I want to go through is exactly how to utilize the Ultra, and most importantly, making sure that Haley understands exactly what she needs to do, because compliance is the most important thing. We know the product is very good and it's going to work, but it's those patients that will do it for a few days and stop is where we really and truly need to make sure that we emphasize that, you know, bleaching comes from time. And in order for Haley to get the best shade change, we want 2, 3, sometimes 4 Vita shade changes. We're not going to get that if we don't really stress the fact that she has to do her part. And this is probably the number one thing that I see with team members is they don't really give good home care instructions. So please make sure that you're doing that. With the Ultra, there's going to be 7 days worth of product. So when you open this box, we're going to see 7 trays inside. Now let me show you what that looks like. In every box, you're going to have 7 days worth of trays. And so what I want to just kind of feature first is exactly what the trays look like. There's a lower and there's also an upper, and making sure that you show this to patients. Believe it or not, people don't read. And I've had patients put the wrong tray on the wrong arch. I actually have one of these that I'll open up and use as a demo, just like I'm kind of doing today to show patients. But what I want you to understand is there's a lot of bleach in here. So we really need to go through good, thorough home care instructions. The first thing that I also want to just show, or another thing I want to showcase, is how much bleach is in this tray. If the patient puts this on their teeth and pinches it too hard, they can actually push the bleach on the gums. And remember, this is a hydrogen peroxide. It's very strong and it can irritate and even burn the gum tissue. So we want to be really careful. So let's do Haley's first whitening treatment while she's in the chair. And I actually like to do this for patients because I want to make sure that they understand the process. And most importantly, again, we're going to get the best end results. The first thing that I'm going to do is I like to start with the lower tray. So I'm going to just kind of lift this out. And Haley, I'm going to have you just kind of watch me here, okay? And I'm going to give you a mirror. I'm going to have you hold that mirror for me, and I want you to turn your feet around this way and just watch me, okay, as I go to place this. Now, you'll see that here, there's a little mark right there in the center. Do you see that?
Yes.
So the first thing that I'm going to do is I'm going to see this right in the center, okay? And again, remember that I don't want to pinch it too hard, but I do want to pinch it enough to where I've got it stable on the teeth, okay? There we go. And then I'm going to go to the upper. I'll slide that one in. Now I want you to close ever so slightly, bring your teeth together and close all the way just a little bit. And I want you to kind of, almost like you're going to kiss, right? And kind of wrap your lips around that. Kind of suck it in like this. Watch me. Okay, kind of suck it in. There you go. And then put your lips around it. And you're just going to close just ever so slightly, just like that, okay? Now, the one thing that I will say is that I like it when patients are laid back just a little bit because we're sitting forward. What comes forward? The saliva, right? So I always tell patients, hey, when you're doing this, watch TV. You don't want to go and work out. You want to just kind of sit and really just take some time to yourself. Because this really only needs to be in her mouth about 20 minutes. It says in the directions 15 to 20. Remember, Haley had no sensitivity, and now with the added potassium nitrate, she really could wear it a little bit longer. So, but again, we want to really stick to the directions, and it says 15 to 20 minutes. So she'll do this for 20 minutes here in my chair, and then start the second tray tomorrow, every day for 7 days. This is so important, making sure that patients do not skip a day, every day. So I'm going to take this from you, Haley, and what I want to do is just kind of go through just a few other little tips here, just so this way the dental team will know some things that you could say to patients to make sure that we have that compliance. So while Haley is, getting her teeth lighter and we're waiting here for the full 20 minutes, I want to just kind of give a couple of tips to really, again, making sure that you understand exactly the things that we need to be saying to patients. You have two options with the Venus White Ultra, okay? It comes in 11.2 and a 15. The beauty of the new formula is that it does have that added potassium nitrate. And for those that don't know a lot about chemicals, this really helps when it comes to sensitivity. And having that added benefit, a lot of times for patients who have sensitivity, they kind of shy away from doing the whitening, or they're going to go with something that's over the counter that is not as strong. And this is where we really can have that confidence now, having that potassium nitrate. I feel really good with offering that to our patients and knowing those that have sensitivity. This is a great option. The second thing is that remembering that when I went through exactly how to place the tray, and most importantly, making sure that she doesn't pinch it too hard, because there is a lot of bleach, and you're going to see that when we show you the photos of what each tray looks like. Patients will pinch it too hard, and trust me, if they pinch it too hard, the hydrogen peroxide, very strong, is going to touch the gums and it's going to irritate it. What happens if that happens? Well, it's not like patients are going to say, gee, that feels good, I'm going to keep doing that. But what I do is I will have them make sure they dry their teeth really good, make sure things are really nice and dry. So when we place the tray in there, it's going to not only be stable, but another thing that you can do is either add some vitamin E oil to the gums or some chapstick, whatever, to kind of help make sure that we keep the whitening agent away from the gum tissue. But I can tell you saw how easy it was for me to place it on Haley, but that's something that you could do. The next thing is if patients do get any kind of irritation, utilizing some vitamin E oil is always good, and it will go away usually within 30 minutes to an hour. But this is why it's so important and why I like to do the first treatment in my chair. I don't want to just hand somebody a box. Again, this is a hydrogen, it's very strong. And I think that's the mindset that team members have, is because it is a pre-filled system, it's not strong. And trust me, it can burn you. So you want to be careful. But I will say that I have had so many patients that I've utilized the Ultra with. I love having a pre-filled option. I love also having a system. So this way we have something for everyone. It is also, again, thinking about the next percentage down, that 11.2 is really good for young adults, teenagers. So again, I'm very, very excited, but most importantly, really excited to see what Haley's going to achieve, especially since it's been, again, going back to those years and years ago of doing the first, introduction to Ultra. So we're going to see what she gets. Documenting the shade, showing patients the shade, taking the photos, that is so realistic. And then when we see her again in 7 days, I'm going to reshoot those same photos that I took. I'm going to take that full face. I'm going to take the smile. I'm going to take the retracted views. And again, taking that shade tab to show her this is where you started and this is where we are today. And we're going to celebrate together with that amazing shade change. And so now that it's been close to 20 minutes, we're going to remove the tray. I want to share with you exactly what I'm going to show patients and tell them what to do once they're finished with each whitening procedure at home, to make sure that we get all of the whitening agent off of their teeth. And then this way, making sure they're going to be in compliance every day for 7 days, not skipping a day. Okay, so now we're going to remove the trays. It's been 20 minutes. Haley, I'm going to have you hold that mirror for me, okay? This is exactly what you're going to do, and it's going to be a little bit gooey, because what happens when we put the tray on the teeth, the whitening agent is going to kind of melt into the teeth, which is what we're looking for. So when I pull it away, it's going to kind of be gooey. Now, when you're at home, when you take this tray out, what you're going to do is you're going to brush your teeth really good and get all the bleach off. Now it's been 20 minutes. I'm going to take out, open for me just a little bit. I'm going to take this out, okay? Just the lower. All right, and then I'm going to take out the upper tray. Now, it's a little gooey, right, because it's been sitting on your teeth, and really that whitening agent is melted. But, wow, what do you think so far?
I can already tell a difference.
Looks really good, especially for just 20 minutes. I will say that, ideally what I would tell patients is once they take these trays out, brush your teeth really good, get all of the gel off of there. But it's critical here that even though we see already a good, it's already starting, right? It's already working. We've got a good shade already showing up here within just 20 minutes. I want to make sure that she knows that, we have to continue the whitening process every day. Don't skip a day, okay? Every day. 20 minutes, that's nothing, right? but it is really important because if she does not continue this whitening process and wear the next tray tomorrow, it's going to relapse. And we want to do every single day for 7 days. But I can guarantee that if we already see this kind of result in 20 minutes, just think about what Haley's going to get in 7 days. And so that's super easy for you to do, right? 20 minutes a day, again, not skipping a day. Those words are very, very important to make sure that we have that compliance from patients. So when we look at where Haley was, and again in just 20 minutes, that's a really, really good sign that we know that she is going to achieve some amazing results. Again, that home care instructions every day for 7 days, don't skip a day, but it's just 20 minutes. That's nothing. Just really making sure, again, if you're the person that's going to be delivering that instruction to the patient, I also want to schedule them in 7 days. I want to make sure that, they do it. And again, stressing the fact that 20 minutes a day, every day, don't skip a day, and we're going to see some really good shade change. And I'm excited to really be able to share that with you when Haley comes back here in just a few days to show you that really nice before and after. So thank you so much for your time today, and I appreciate Kulzer allowing me to really showcase this. I'm excited at the fact that it's been many, many years, 2016, that we whitened Haley the very first time, and then now having that comparison with the new formula with that 15% potassium nitrate. It's really going to be a great, exciting time for us to really put those photos up side by side and to share that outcome with you. Thank you so much, and look forward to sharing the rest of this whitening procedure with you very soon.